Hi, my name is Valerie Leisure. I'm the Director of Physical Therapy here at Arkansas Surgical Hospital. I'm going to be reviewing some how-tos for your mobility after surgery. I'm going to be reviewing tips on how to get in and out of a chair properly following surgery. For most surgeries, you do want to choose a chair that is higher off the ground, more firm, and also has armrests. If you are viewing this prior to your surgery, you may want to consider which furniture you plan to spend your time on at home. And if you don't have anything that's appropriate, possibly consider purchasing or borrowing a piece of furniture that will work better. If you have a lower extremity surgery, including knee, hip, and ankle, when you go to stand up, first you'll want to try to scoot towards the edge of your seat. Keeping your surgical leg slightly forward will cause you to place more weight on your non-surgical leg. As you go to stand up, you'll want to use your non-surgical leg and arms to press up into standing. When you go to sit, again, you'll want to step your surgical leg slightly forward, reaching back for your armrest and slowly lowering yourself down. When you're getting up and down from a chair following a surgery to your lower back, you want to utilize your arms and legs as much as possible. First, scoot forward to the edge of your seat. Press up using your legs and arms, keeping your back as straight as possible. When returning to sitting, bend your knees, reach back for your armrest, keeping the back again as straight as possible. Great job.